The doctor says you have cancer.
You have cancer.
Now what? What do you do now?
Treatment.
What treatments? Where?
There's a place called Hope.
Hope Lodge. A home away from home.
The cancer journey can be pretty confusing. It can be lonely.
That's why we're here.
We're here to help.
We can get through this together.
Prostate cancer is the most common cancer among men in the United States, with nearly 3 million survivors. How do you know if prostate cancer screening is right for you?
We'll be celebrating Take Your Loved One to the Doctor Day and giving tips on how to encourage regular checkups.
High prices at the pump, hotel and food expenses. With these rising costs, many cannot afford to take vacations or travel great distances. But what if you've been diagnosed with cancer? You might not have a choice but to travel to receive life-saving treatment. Here with us today is medical oncologist Dr. Bill Hocking and Hope Lodge Administrative Assistant Jewel Quell. We begin with prostate cancer, Dr. Hocking.
Yes, prostate cancer is the most common cancer among men in the United States. About 1 in 7 men, or about 230,000 cases per year, occur in this country. Prostate cancer is mainly a disease of older men. About 6 out of 10 cases will occur in men over the age of 65, and it's really quite uncommon before the age of 40. There's also some increased risk among African American men as compared to Caucasian and other ethnic and racial groups.
So, Dr. Hocking, tell us, what is prostate cancer?
Well, prostate cancer is a disease that begins in the prostate gland, which, as you can see in this diagram, is located just beneath the bladder. And it's a malignancy that originates in that tissue. The prostate gland is one of the sexual organs in the male that is responsible for producing some of the secretions that occur with ejaculation. Cancers that begin in that gland are localized and then may gradually grow, spread locally, involve local lymph nodes, and then ultimately may spread through the bloodstream to involve other organs, and that's when the cancer really becomes dangerous to the individual.
Is there a way to detect it early? And we talked about screening earlier, so.
Yes, screening for prostate cancer can really be done through 2 approaches. The traditional approach had been through doing what's called a digital rectal examination, where the examiner can actually feel the prostate gland through the wall of the rectum. That has largely been replaced with a blood test known as the PSA, which stands for Prostate Screening Antigen Test. This is a test that was developed really in the 80s and became approved by the FDA in about 1994. You can see on this slide that the incidence of prostate cancer suddenly jumped very dramatically in the mid-1990s. And that really was not because there was suddenly an increase in the number of cases developing, but it was because we were suddenly beginning to detect cases at a much earlier stage due to the implementation of the PSA screening test.
So is there a particular age, or what is the determination for who should be screened?
This is screening for prostate cancer is a controversial area. In general, it is felt and recommended by many of the public health groups, including American Cancer Society, that screening should begin in men at about age 50 if they are felt to be of average risk, and should be continued until about age 70. But screening for prostate cancer is something that really should be addressed individually with each person, with a discussion of the pros and cons of screening. There are a variety of issues that come into play with prostate cancer screening. The pros obviously are that you may detect cancers at an early stage, and there may be an increased chance of survival and cure of the disease as a result of that. Some of the cons, however, are that there can be false positives. There may be an abnormal PSA result that is not due to prostate cancer. Sometimes inflammation of the prostate can cause this. There's also a phenomenon of overdiagnosis. This is the situation where a true cancer is discovered, but it is a cancer that would have been very low grade and not have harmed that individual. But once it's discovered, then there's often pressure to implement treatments that can have a variety of side effects. So in some cases, the man might really be better if the cancer had not been discovered. You also have all of the issues there of anxiety and having to live with a diagnosis of a disease that perhaps would not have caused you trouble.
I can surely see that. You know, at Hope Lodge, we see a lot of patients with different kinds of cancers, and you know that every day there's some fear or concern about that. So just the thought of living with a cancer would be kind of scary.
Yeah, just being given a diagnosis of a disease that sounds very scary but may in fact not be a threat to your life. And part of the difficulty with screening is that we're able to make the diagnosis, but sometimes we have more difficulty discerning which cancers are going to be life-threatening and which are not going to be life-threatening. And then the other cons simply relate to the fact that there can be complications from the diagnostic procedures themselves, from doing the biopsy, and certainly there are complications related to prostate cancer treatment.
So once diagnosed, then what steps to take for treatment are there?
The first step is to make a diagnosis, and that usually involves doing a biopsy that is done with an ultrasound probe, actually through the rectum, the biopsy needle being inserted into the prostate gland to take multiple samples. But once a diagnosis is made through a biopsy of the prostate gland, then one has to consider the treatment options. And with prostate cancer, there really are 3 treatment options for a localized prostate cancer, which the vast majority will be at the time of diagnosis. One option is what's called surveillance or observation, and that would be in a patient either in whom you feel that this particular cancer is not likely to be life-threatening. That would be a low-grade cancer, or in whom you feel that the patient perhaps has a limited life expectancy and is not likely to live long enough that cancer would ever do them harm. So somebody that had a lot of other health problems, you might not recommend any specific treatment other than monitoring of them. So that's one option for treatment. A second option for treatment would be surgical removal, which is called radical prostatectomy. That can be done either as traditionally done through an open procedure or through a robot-assisted procedure, which uses smaller incisions with the assistance of the robot to do the procedure. And those 2 approaches surgically have been shown to be really pretty much equivalent in terms of the outcomes, both in terms of complications and the effectiveness in treating the cancer. And then the third approach would be to treat the prostate gland with radiation therapy.
Is there ever an instance where you would have surgery in addition to radiation?
It's sort of the other way around.
Okay.
It would be unusual to have radiation followed by surgery, although occasionally that does occur. It might more commonly be that you would have surgery followed by radiation. There are some instances where if the if the pathologic findings that are discovered at the time of the surgery, as the pathologist looks at that tissue, indicate that the cancer has spread locally out to the margins of the resection, then one might consider the addition of radiation therapy following surgery.
Okay.
What are the side effects? Was it every cancer and treatment we hear different side effects? Are they very similar in the prostate cancer, or is that different?
Well, they're fairly unique, actually, because of the area that is being treated. With surgery, you have the risk, of course, of any surgical procedure has the risk of general surgical complications. But specifically here, the issues relate to problems with urinary incontinence following surgery. That is, difficulty controlling the need to urinate. And that's something that is common but often improves over time as you get further away from the surgery. The second major issue would be sexual issues, particularly difficulties with obtaining erection because of the nerves that are affected by the surgical procedure. So those are probably the two biggest things with surgery. Those complications also can occur with radiation to the prostate gland. In addition, after radiation, there can be complications related to radiation's effect on the rectal tissue, which, as you can see from the diagram we showed earlier, is right behind the prostate gland. And so the rectum can be affected by that, and you can have some problems with what's called radiation proctitis. And that is manifested by things like some bleeding, diarrheal episodes.
Okay. It's good to know that we've come so far and understand the disease that well. We're going to take a break, but first, did you know that the average cost of a vacation is $2,800? However, we all understand that cancer is no vacation. See how the American Cancer Society is making a difference. Stay tuned.
All right. It's come to my attention that one of us is now officially an old man.
Hey, watch it, man.
Seriously, Bill, happy birthday.
Thanks, guys.
Happy birthday.
It's going to be a great year.
Oh yeah, what you got planned? A trip down to the old folks' home?
Is that before or after your tea time? Huh?
Now, really, are you and Linda going to take your regular trip to Europe?
Well, if I pass all my tests, actually, we're thinking about taking the grandkids along.
The test, wait a minute. They have SATs for old age? There you go.
There you go. No, man, I got my annual physical next week at my doctor's office. Supposed to be a good one. We're going to do blood pressure, cholesterol, colon, and prostate.
Dude, we're eating. No talk of prostates and colons, please.
Oh, come on, man. You don't want to think about the old love up test? Huh?
Now, actually, guys...
Here we go, guys. Doc is going to educate us.
Well, the reality is that there are some tests that you definitely want to have when you hit a certain age. But it turns out that prostate cancer testing doesn't necessarily fall into that automatic no-brainer category.
Hold up. Well, why is prostate cancer different? I thought catching cancer early was always a good thing.
Well, the deal is that prostate cancer is not just one disease. Not all prostate cancers are the same. Some prostate cancers grow very fast and can spread and cause a lot of harm and even kill men. But other prostate cancers grow very slowly. And those slow-growing cancers may not ever harm that man. As a matter of fact, if he didn't have that screening, he'd never know he had cancer. The big challenge is that the tests that we use to look for prostate cancer don't always tell us if it's a fast grower or a slow grower. So a lot of men end up being diagnosed with those slow-growing cancers, and they end up with unnecessary treatment. And treatment can have some complications.
I don't know if I'd want to go through all that, you know, if it was slow growing and probably wouldn't do me any harm.
Shoot, I wouldn't care about side effects. If they find cancer anywhere, I want it out.
Well, and that's exactly why the American Cancer Society recommends that men learn everything they can about both the good and the bad aspects of prostate cancer screening, and then make a decision along with their doctor about what's best for them.
Makes sense. Well, good luck, Mel.
Hey, thanks, guys.
Hey, by the way, you guys got that catch the other night? Did you see that?
Oh, man.
That was
And say
beautiful.
We're back on Giving Hope a Home. The American Cancer Society supports the idea of Take Your Loved One to the Doctor Day. Now, Jolene, I don't know about your husband, but mine has a pretty solid aversion to going to the doctor. He'd have to be very sick to even consider it.
I think that's a pretty stereotypical male trait,
Right.
Dr. Hawking.
Yeah,
You probably see that in your practice.
I've certainly seen that. I think men in general like to avoid going to see their physician. They try to stay away from the clinic as much as possible, and often have to be encouraged by their spouse or another loved one to seek attention.
And it's probably true of a lot of people, but what can we as women who love men and our husbands or significant others do to encourage them to visit their doctor, maintain healthy habits, that kind of thing? What would be your suggestions?
Yeah, well, I think first of all, just expressing that concern to your husband or to a loved one would be important. Maybe talking about healthy lifestyle, diet, avoidance of tobacco use. That's certainly one of the biggest things, not so much in prostate cancer, which we were talking about earlier, but in terms of general health and other cancers. Use of alcohol in moderation, those would all be important measures to consider. And then I think if there's a specific concern about symptoms, then just really encouraging that person to seek out medical attention would be important.
And then I think it's important too to follow some of those guidelines like you talked about, testing or screening at certain age groups. My husband's over 50, sorry. So it's something that I would encourage him to go and do too, so.
Right.
Yeah.
Well, not to throw my hubby under the bus, but I will. No, I am a typical wife, and I am concerned about his health. So I did take matters into my own hands, and I scheduled all of his appointments for him. And to break the news gently, I made this card, and it went over pretty well. So it is a good tip for any women out there who also love a stubborn man.
American Cancer Society supports a healthy lifestyle. So we can all remember to take the time, pick a day, and ensure that your loved one remains in good health.
Stay tuned to learn how the American Cancer Society Hope Lodge saves cancer patients millions.
Imagine a world with more birthdays. Imagine a world where cancer is scarce. $11 million survivors show the progress we've made and prove that it's not just a dream. We're the American Cancer Society, the official sponsor of birthdays.
back to Giving Hope a Home. We're going to explore the need to travel for life-saving treatment for cancer. If you've been diagnosed with cancer, chances are life-saving treatment you need will be hundreds of miles from home. What you may not know is the American Cancer Society has 31 hospitality homes called Hope Lodge. They're spread throughout the nation, and there's even one in Puerto Rico. What's best is that they are free of charge for cancer patients and their caregivers. Hope Lodges are strategically placed near accredited cancer centers, and we're fortunate to have one right here in Wisconsin, the only one, and it's in Marshfield.
Dr. Hawking, as a physician, in the event that you have a patient that needs to travel here to Marshfield for treatment, what does it mean to you to have a Hope Lodge here for them?
Well, I think it's been one of the most amazing things that has happened in our practice here in Marshfield since I've been here in over 30 years. When patients find out that there is a home that they can stay in rather than a hotel, they're just thrilled to know that. And then when they discover that they stay at no cost to them, it's really just remarkable to watch the reaction. And I think it's been such a relief to patients. It's one less thing that they have to be concerned about as they're dealing with all the issues that one deals with a cancer.
And I suppose it helps too that you're able to help them that much further throughout their cancer journey.
Absolutely, and I think the other thing is once they've experienced Hope Lodge, then they're also aware of all of the other benefits of being in that facility. It's not just a facility; it's really a support group based on the staff that are there, as well as all of the other patients that they encounter at Hope Lodge. That really is very, very meaningful and helpful to them as they're going through this journey dealing with cancer.
And that's just the great thing about Hope Lodge is we started out as American Cancer Society Hope Lodges planning to save patients money because the cost, as you know and we've discussed, is astronomical for hotel stays if they're here for several weeks. And so across the nation, really, we have saved cancer patients millions. Over 43,000 cancer patients have been saved, the cost, but there's also the benefits that you talked about, which we'll discuss a little bit later.
In fact, in this last year, the lodging provided saved cancer patients an estimated $38 million. Let's stop and think about that. That's $38 million.
Yeah,
imagine what you could do with that.
That's really huge. And as you mentioned earlier, the most important factor is that money's not coming out of their pocket.
Right. You know, patients are subjected to so many expenses. The cost of cancer care has continued to escalate. Being diagnosed with a serious illness is actually the #1 cause of personal bankruptcy in the United States, and certainly a cancer diagnosis is one of those reasons. So not having to pay for a place to stay really is helpful from a financial standpoint for our patients.
Yeah. And you alluded to it earlier, but you really can't put a price tag on that peer support that they get, the emotional just base that is there for them of support from not only from the staff, but all the other guests there as well. They just get to communicate with one another. They make old friends, new friends. Just not having to worry about things like that really makes just a huge difference in their healing, I think.
Yes, it does.
Yeah. Everybody at Hope Lodge is really going through the same thing, so they're able to connect with each other that way and develop lifelong friendships as well.
Yeah, it's really quite a privilege for us, I know, as staff, and I'm sure for yourself to be able to refer them and to be a part of such a great thing as the Hope Lodge program.
Yeah.
Yeah. So if a patient is diagnosed in your office, how do you go about referring them to the lodge?
Well, we would contact Hope Lodge and talk to one of you two usually to make that referral. These are patients that are usually undergoing a diagnostic evaluation or beginning some type of treatment or continuing on some type of treatment for their cancer.
Yeah, and usually, like you said, first person they're going to talk to is probably Jewel. She's there during the day when the clinic's open, and they always appreciate her cheerful voice.
Typically, upon receiving a referral, we'll call the patient directly to confirm the reservation. We'll go over some of our background eligibility questions and some of our policies, namely no tobacco, no alcohol on the premises. And then we'll also answer any questions that they may have for us. After that, check-in is easy. We are a locked facility, so the patient would have to ring the doorbell the first time. Once they're in, we go over some paperwork, show them to their room, give them a tour, orientation, pretty much get them comfortable, and then usually we have a dinner ready for them as well. So.
Yeah, it's really a pretty easy process.
And I think it's important to point out also that a caregiver, either a spouse or another person that's helping them, can also stay at Hope Lodge with them.
Exactly. Yep. We have 22 guest rooms, all of which are supplied with a queen-size bed, and some of them are suites with a queen-size sleeper sofa. So if there's sleeping problems or issues that's divided by a wall, they can the patient can sleep while the caregiver maybe sits watch TV, or vice versa, something like that. They're really great private rooms.
The recliners are a hit as well. Those get utilized quite a bit.
Yeah.
The recliner, the desk.
Yeah, they're really accommodated like a hotel room, only for long-term, and really much more in meeting their needs specifically because of their treatment process.
Yeah, it's more of a homey environment.
Yes, we are home away from home with hotel amenities. And what's great is that it is free of charge to the cancer patient and their caregiver. There is no cost for them to stay there. But it does cost us something to operate it every year and every day, and that's where our generous donors come in. We have many donors throughout the years that have supported the lodge, and we continue to rely on that support to make it free to cancer patients.
American Cancer Society Hope Lodge serves as a home away from home, free of charge for adult cancer patients and their caregiver. All bed linens and towels are provided during a guest's stay. Guests are encouraged to use the on-site facilities for laundering throughout their stay. We have several common rooms for lounging and visits with friends and family. Our goal is to make your stay as comfortable as possible.
In case you missed any of our topics today, you can watch this and previous episodes on marshfieldtv.com. Or for more details, go to www.cancer.org, where you can search for anything cancer-related, including information on donating to the American Cancer Society Hope Lodge.
Thank you for joining us on Giving Hope a Home.